So we've talked about what a zygote is, how do we get to fertilization, how do we form these extra embryonic membranes and whatnot, but we haven't really gotten into the stages of development. We've thrown around words like fetus and embryo, but we haven't really talked about when those are the correct terms to use. So let's go through the stages of development, talk about what's happening, and look at basically how do we go from this one single cell to this complicated, multicellular, beautiful organism that we are, a human. Our first stage is the preembryonic stage of development. This is the very first week after fertilization, so pregnancy at this point has not happened yet. We're pre-embryo at this point. Number 2 is embryonic development. This is after fertilization has happened and implantation has happened, and will continue through the end of the second month. The third step is fetal development. This is months 3 through 9 of development. And then lastly, development after birth. Even after birth, we're not quite cooked yet, right? We still have to grow and change and learn through infancy. We go through changes as children. We hit puberty and blossom into adolescence and then adulthood before hitting our elderly stages at the very end. So let's start from the very beginning, pre-embryonic development. During pre-embryonic development, again, we've gone through fertilization, but we have not yet implanted. In order to implant, we have to go through a series of steps, a series of changes before we're ready. One of the first things we have to do is go through a process called cleavage. We're going to go through mitosis and divide and divide and divide and divide and increase the number of cells, but we're not going to grow. We'll see that in just a second of what that means. Once we've done this several times, we form this morula, this little ball of embryonic cells. Nothing is specialized yet. Nothing looks familiar or human-like yet at this point. We then start to move around and change our shape a little bit and form what we call the early blastocyst. This is where we're going to separate out the cells that are going to become those extra embryonic membranes and the cells that are actually going to become the embryo itself. Like I mentioned earlier, not every cell in the preembryonic stage is actually going to be part of our own body once we are fully developed. Some of these cells are going to become part of these membranes that are not going to stay with us throughout life. And then finally, implantation can happen. This is about day 6 or 7. So you're looking at about a week-long process to go through this division without growth and dividing ourselves into the embryonic part and the extra embryonic part. Implantation is when this embryo will finally embed itself into the side of the uterus. This is where we would now call someone pregnant. So let's look at what's happening. We have ovulation where an egg is released. This egg is ready to be fertilized. Fertilization happens. We go from one single cell called our zygote. In cleavage, remember we are dividing, we're using mitosis, but we're not getting any bigger. I mean, we take this really, really large single cell and we split into 2 slightly smaller cells. Then we divide again into 4 even smaller cells. And then 8 even smaller cells. The size, the volume is the same in each of these stages. We're just splitting ourselves into smaller and smaller cells until we finally form this little morula, this little ball of cells. We then see our first kind of separation of cell types where we have the inner cell mass. This is here in purple is going to be what will become the actual embryo. And all of these other cells we see around, which are going to become part of the chorion, the extra embryonic membranes. Throughout this pathway, as we've gone through cleavage and become our early blastocyst, we're traveling from the oviduct and traveling towards that uterus. So fertilization actually happened way up here. It did not happen in the uterus. We've traveled, and finally, once we've become that blastocyst, we can implant ourselves into the side of that uterus, into the wall, and form the early chorion. So this is our first week, right, after fertilization happens. And it's important to note that this, in many cases, doesn't quite make it further than about here. In many cases, An egg may be fertilized and a woman may never realize that it happened because something went wrong in this process and it never got to implant. In which case, that woman would not be pregnant and she probably would never even notice that anything happened. This is more common than you'd think, and it's an important discussion to have since things like miscarriage and loss of pregnancy and challenges getting pregnant can be so taboo in our culture. So it's something to think about. It's also something to think about of when we look at where fertilization happens. It happens in the oviduct. And this is one of the reasons why an ectopic pregnancy is so dangerous. If you're not familiar, an ectopic pregnancy is where this early blastocyst actually never gets to the uterus and instead it implants somewhere along the oviduct. That's an extremely dangerous situation for a woman because this oviduct cannot handle and cannot nourish that developing embryo. It can't handle the growth. And so if someone were to not have that pregnancy terminated, they could lose their ovary, they could hemorrhage, and worst case scenario, that woman could die. Something like an ectopic pregnancy is a severe medical condition that needs proper treatment from medical personnel. It is not something to be joked around about, and it's not something to be treated lightly. It's an extremely dangerous situation to be in for a woman, and it will result in the loss of that pregnancy. If it doesn't get treated, not only will the pregnancy be lost, but potential fertility issues could happen since the woman may lose the ovary, or worst case scenario, she can lose her life. If implantation does happen, we enter into week 2, embryonic development. This is where now pregnancy would be said to begin. The female body will start secreting human chorionic gonadotropin, or HCG for short, and that's going to keep the corpus luteum around, and as long as the corpus luteum is kept around, progesterone will be secreted and keep that inner lining of the uterus around. HCG is also the basis for a pregnancy test. So when a woman uses a pregnancy test and she urinates on that little stick, it's looking for HCG. During the second week, we see that inner cell mass will detach itself and become what we call an embryonic disc and go through what's called gastrulation. Gastrulation is the folding inward on itself where we start to form the very first opening that will eventually become part of the GI tract. You can develop either mouth or anus first, depending on what species you are, and as humans, I'll let you guess which one. If you haven't guessed yet, I'll tell you, we develop anus first. Fun fact. We're also going to see our three primary germ layers develop: the ectoderm, the mesoderm, and the endoderm. So here we are at about 18 days. We are about 2.5 weeks in. So we have the chorion that has implanted itself into the side of the uterus. We have the embryonic disc and the yolk sac, and the amniotic cavity are already starting to develop. Now we mentioned these germ layers, but we didn't really talk about what they are. These germ layers, the ectoderm, the mesoderm, and the endoderm, are the first kind of differentiation, the first specialization we see in our cells. So we have those 3 layers, ecto, meso, endo, that are going to eventually become very specific structures in our bodies. So all of the cells that form your epidermis, the outer layer of your skin, at some point came from the ectoderm. None of your epidermal cells came from the mesoderm or the endoderm. So it's the first kind of pathway we see to seeing all of the specialized tissue we have in our bodies. Let's go over just a few examples of the different cells we see in the adult human body and which germ layer they all originate from. So the lining of your mouth and rectum come from the ectoderm, and surprisingly enough, the nervous system also comes from the ectoderm. The mesoderm is really where the majority of your guts come from. Your bones, your muscular system, the dermis of your skin, your cardiovascular system, your urinary system, your reproductive system, The outer portions of your respiratory and digestive systems all come from the mesoderm. And then the endoderm, the very, very, very inner portion, is the inner lining of your digestive tract and your respiratory tract, the glands that are associated with both respiratory and digestive systems, and the inner lining of your bladder are all coming from the endoderm. Moving on to week 3, we're seeing more changes and the nervous system has started to develop. That's going to be our first major organ system we see in development. It doesn't quite look like an adult nervous system yet though. Instead, what we see is what we call a posterior neural tube, which will eventually become your brain and spinal cord. We also see the beginnings of the heart's development. We get to weeks 4 and 5. Now our embryo is a little bit larger than the print from a textbook, and the chorionic villi have formed. We're starting to see an umbilical, and we're seeing the beginning of limb buds. Not quite arms and legs yet, more like little extensions of flesh that will eventually become the arms and legs. During the 5th week, the head starts to get larger, the eyes, the ears, and the nose become a bit more prominent, although it still doesn't quite have an adult face-like appearance yet. So here's weeks 4 and 5. Up here in the right, we have weeks 4, and over here we see about week 5. If we look closer, again, we are seeing somewhat of a face, but again, nothing has developed far enough to look like the human face we're used to, although there are some key features we can point out. Right? So we have like the optic vesicle, we have a brain, we have the regions for the heart and the liver. Here's a limb bud, so it'll eventually will become like an arm. So again, it's not quite what we're used to when we think of a human face, but we're starting to get there. We're starting to see some of those structures. Moving to weeks 6 through 8, now we're starting to look more and more human-like. We're also seeing reflexes happen, and all of the major organ systems have been established, although they're not quite close at being done at developing. By this time, we weigh about the same as an aspirin tablet. We're still on the very, very, very small side. Now we move into fetal development. Once we've hit months 3 and 4, we now consider this to be a fetus, not an embryo. At this point, hair starts to develop, and if you remember from the embryonic side, the head was growing very, very fast, but the body was staying pretty rudimentary. During these months is when the body's going to catch up with the head. We start to see cartilage being replaced with bone, and now we're starting to be able to tell females from males apart and hear the heartbeat. By the end of month 4, the fetus has grown to a large 6 inches long and 6 ounces heavy. It's much, much different from the aspirin tablet we talked about just a couple months prior. Moving into months 5 through 7, now fetal movement can be felt by the mother. The fetus is hanging out in that curled up fetal position. The eyelids are open. And we've basically doubled in length to 12 inches and have gained a whopping 2.5 pounds roughly, so we're about 3 pounds total at this point by the time we get to around month 7. In the last 2 months, we're gaining about 1 pound per week, and the fetus is moving itself so that the head points down towards the cervix. We're basically preparing for birth. By the time we get to the end of month 9, we're about 7.5 pounds and 20.5 inches long. Now, through this whole process, you can imagine that this embryo and fetus, as we go through development, is extremely sensitive to problems and changes in substances that can be consumed. When it comes to birth defects, there are some that are preventable and some that are not. It's important to note that if you have a child born with a birth defect, there is a possibility that it's not the mother's fault. Some things are congenital. It's genetic. It's something that the mother happened to have in her genes, or the father had in his genes, and the offspring happened to get those copies. However, there are birth defects, or there are things we can do to help minimize the risk or prevent certain birth defects. One of the big ones is to get physical exams by a trained doctor. If you know what to do, if you have a good working relationship with a doctor, they can guide you down what you should or should not do. Other things that are kind of straightforward, making sure you're maintaining your health. Are you eating properly? Are you sleeping properly? And are you exercising? One thing to note is that, and it's a popular phrase to say, I'm eating for two. That's not quite proper nutrition. Keep in mind, we talked about this embryo being the size of an aspirin tablet at one point. An aspirin tablet sized embryo does not need 1,500 to 2,000 calories. So make sure that you're following what the doctor tells you when it comes to increases in caloric intake. Make sure that you're sleeping, and then exercise. Now, this is again where a doctor comes in and can tell you what you should or should not be doing. If you are not very athletic or you don't exercise very often, you probably don't want to go in and start doing a bunch of deadlifts in the gym. However, if you are very fit already, you probably don't need to limit yourself as much as some people might think. Again, it comes down to talking with that doctor and making sure that you're staying active, but not overdoing it where you could potentially harm that developing fetus. Avoid smoking, alcohol, and drug abuse. Smoking can result in things like low birth weight. Alcohol can result in things like fetal alcohol syndrome, and drug abuse can result in babies that are born already addicted to medications or drugs, and can and does result in children being taken away from the mother at birth. Avoid having x-rays. This is one of those reasons why they ask you if you're pregnant, if you are a person capable of being pregnant, when you have to go get an x-ray. And avoiding certain medications or supplements. Make sure to talk to your doctor about all the medications and supplements, both prescription and over-the-counter, that you use. There are certain medications that you don't want to use while pregnant, because while they're perfectly fine and safe for an adult human to use, they're not safe for a developing fetus. And then avoid getting an STI, or know if you have one. Get tested. Like we mentioned in a previous chapter, there are STIs out there that can cause complications during birth and can be passed from mother to baby. If you have one, talk to your doctor about it and go off of the treatment that they suggest. Lastly, fetal circulation. Now, we had mentioned in the cardiovascular chapter that the pulmonary circuit was reversed, in that the veins carried oxygen-rich blood and the arteries carried oxygen-poor blood. That was our only caveat to the oxygen-rich artery versus oxygen-poor vein argument that we had made early on. This is our second caveat that we're introducing. When we look at the umbilical cord, it's actually reversed. The umbilical veins are going to be oxygen-rich, and the umbilical arteries are oxygen-poor. We also make note that the mother's blood and the fetus's blood do not mix. Instead, diffusion across this area, across the space, goes from the mother's bloodstream to the fetus's bloodstream. We don't ever actually mix the blood up together. This is why we can have a fetus with one blood type, and the mother can have a different blood type, and it's relatively safe during pregnancy. The only time it would be dangerous is if the mother has developed antibodies against an Rh positive baby when she's Rh negative. But even then, that will only happen when she has her second baby, not the first.